Good morning and welcome to the CERT C3HUB website, a demonstration webinar. I'm Mary Muko. I am one of the members of the WPS Provider Outreach and Education team, and I'll be your presenter today. I am joined by my friend and colleague, Ashley Decoto, also being joined by Bailey Lawson, and they'll be assisting with some behind-the-scenes help. This webinar today is for people who'd like to take a peek at the CERT C3HUB website. It is, just as advertised, a demonstration. But first, this presentation is available for download from our live events webpage. The webpage address is in the chat. You can take time now to download it if you've not already done so. We will be recording this session, and barring technical issues, we'll post it to our Encore Presentations webpage, where it will remain for about 60 to 90 days. The recording will also post as a YouTube video on our YouTube channel, and it will remain there as long as the information remains current or until we otherwise decide to remove it. Now, if you have questions throughout today's presentation, please do put them into the chat. I will be answering questions as time permits, but if I don't get to your question, I will email the response after the webinar, either directly to the learner, or I will compile a list of questions and answers and send it out to all those who participated today. If you have any claim-related questions today, I am unable to provide answers. For claim-specific questions, you need to contact customer service so they can access claim details in the claims processing system. Those of us in provider outreach and education, like Ashley and Bailey and myself, do not have access to claims history information. Here's a disclaimer that we include in all our live events, and we do so to let you know that this presentation is for educational purposes only. I did make every effort to verify that the information I will provide today is current and accurate, but it is subject to change. It is on the CMS website that you'll find Medicare rules that determine final coverage, and these laws, regulations, and rulings will always prevail. CMS does prohibit recording of this webinar for profit-making purposes, and because we don't know how you might use the recording if you record the presentation, we have to ask you to simply refrain from doing so altogether. Remember that we will create an encore presentation and you'll be able to use that for future reference. Here is the agenda for today's event. I am going to start with some details for submitting records to Comprehensive Error Rate Testing Review Contractor, or the Comprehensive Error Rate Testing Review Contractor. We call them the RC. You're going to learn to find other things such as sample letters and contact information. I'll also show you where you can find the document request listings that the CERT contractor has compiled and more. So basically what I'm doing today is showing you or walking through the CERT contractor's provider website, and we call that website the CERT C3HUB. The CERT C3HUB is maintained by the CERT contractor for CMS. It's not a WPS website. As I mentioned, it is maintained by the CERT contractor, and I've included or embedded a link to their website in your presentation materials for you. Here is a list of all of the items or the content of that CERT provider website, and in just a moment I am going to actually pull open that CERT C3HUB website and start showing you the contents and walking through it and talking a little bit about each. I will provide you with all of the information you see here on this slide, and I'm not going to read through these because I'm actually going to be going through them as I do my demonstration. I am working on my other monitor at this time to pull open that CERT C3HUB website. Excuse me, and I'll be opening it, showing it to you in just a moment. There it is. All right, you should be able to see now the homepage of CERT C3HUB. And again, CERT is Comprehensive Error Rate Testing. That is a program. This website, or that is a program actually that CMS initiated in order to measure the national improper payment rate for Medicare fee-for-service claims. But the CERT C3HUB website is then designed to provide those Medicare providers and suppliers and contractors with information about the program itself, and to facilitate, as you can see there at the top of the page, coordination, collaboration, and communications between all of the stakeholders. And this, of course, would provide, or would include, the providers and suppliers as well as contractors. So you can see on the CERT C3HUB homepage the various features here on this website. They're all listed right here on the homepage. You can easily move around, of course, on their website by choosing from the menu on the left-hand side of the website, or on the screen, or the view. But you can easily, of course, go back to the homepage if you need to do so. In addition to showing the features of the CERT C3HUB, the CERT contractor also places announcements here at the bottom of their homepage. So you will be able to see any announcements that they are making, those intended, of course, for anyone who uses this particular website. So items of interest, and so on and so forth. So I'm just scrolling down a little bit so you can see there's quite a few announcements out there that the CERT contractor has placed here on their website. All right, let's start with our tour of the website then, or our walkthrough, if you will, starting with About CERT. Some of you may have just recently had an opportunity to listen in or view the presentation that I just did about CERT. It was kind of an overview of CERT, didn't really get into a deep dive of it, but it talked about the process itself. And here on this page, or on this feature of the CERT C3HUB, the CERT contractor talks about why CMS developed this program. And of course, it's just as I mentioned a couple of minutes ago, to calculate the Medicare fee-for-service improper payment rate. So this talks just a little bit, provides just some background and an overview of the CERT program itself. Basically, what happens during CERT review is that supporting documentation is retrieved from the provider or supplier who submitted the claim to the Medicare administrative contractor, and then it's reviewed by an independent medical reviewer to make certain that the claim was properly paid based on coverage coding and billing rules for Medicare. There are various categories of errors that are assigned for those errors, or those claims found to be improperly paid. You can see them listed here on this About CERT webpage on the CERT C3HUB. The webinar that I just recently conducted actually talked about those 5 categories and a little bit more about the process itself, but that information is here on this webpage also. If you scroll down About CERT, you will find some information about the CERT program contractors. There are 2 contractors for CERT. One is the CERT review contractor, or the CERT RC, and the other is the CERT statistical contractor, or the CERT SC. If you look here at the bottom of this page, you'll see for each of those contractors some examples of the responsibilities for each of them. The CERT review contractor is going to do the claim sampling. They'll image records after requesting them and receiving them. They're going to do that quality control on all the image records, and they're going to review those records and compile the data. They are also the one, the CERT contractor that is responsible for this website that we are viewing today. They also maintain the CERT claim status website, which is used by the MACs, and MAC is the Medicare Administrative Contractor. And they also maintain the CERT management website used by CMS, but we won't be looking at those today. Just as I advertised, today is just a kind of a demonstration or a look at or walkthrough of the CERT C3HUB. The CERT statistical contractor is responsible for calculating the improper payment rates and amounts. They actually do design that sampling strategy. The CERT review contractor is the one, of course, that samples the claims, but the statistical contractor designs that sampling strategy. And they also maintain the live data dashboard, and you'll be seeing that in just a few minutes. Next on the menu is Submit Records to CERT. And this particular web page shows you the various ways that you can submit documentation to the CERT contractor. You can use postal mail. You can see the mailing address there. There's also a mechanism where you can send your records via fax. You can also send them via electronic submission of medical documentation, and CMS calls that SMED for short. You can send them via CD or also in an encrypted, password-protected email attachment. So those then are the submission methods for submitting your records to the CERT contractor. The next feature of the CERT C3HUB website is letter and contact information. It is the CERT review contractor that issues that additional documentation request or ADR letter to obtain those medical records for those claims that are sampled for CERT review. Here on this page, you can see an initial request to schedule. And what that means is it is the initial request that's sent by the CERT contractor. So claim is selected for review. That initial request letter is going to be sent out. And you'll see two separate sets of days here. One is for claims with the universe prior to July 1 of 2024. That is the CERT report year 2025 and earlier. And one is the newer set of dates for the claims universe date on or after July 1 of 2024. And that is the report year 2026 and later. Basically, the change here is that it used to be 76 days were allowed to get that, or 75 days actually, were allowed to, send the request letter and make those telephone contacts to follow up, send the second letter, and so on and so forth, follow up, third letter, follow up. It used to be 75 days that were allowed before the claim would be counted as a non-response error. And that would mean that the claim would be subject to any overpayment recovery if any payment amount was made on that claim. That number of days has been reduced from 75 down to 60. So you can see the day schedule for that initial request of medical records, that schedule has changed. Now, sometimes the CERT contractor receives the medical record documentation from the provider, but recognizes that something was missing or there is a need to send to the provider a request for additional information. So a new additional documentation request is going to be sent, and that's what this schedule is here at the bottom of the page, the subsequent request schedule. And you can see that's 16 days. Moving down the page for letters and contact information, you will find how to submit address updates to the CERT contractor. All first additional documentation or ADR request letters are sent to the address file that is shown in the provider enrollment chain and ownership system for that particular provider or supplier that submitted or billed that claim to Medicare. Subsequent ADR letters can be sent to an alternate address, and this is specific to each individual claim review or claim identification number. And it tells you here how you can contact the CERT customer service representative to set up that all subsequent ADR letters can be sent to a single point of contact. But remember, it is specific to each individual claim identification number. So for example, if one of your claims is selected in January for review, The first additional documentation request is going to go to that address list on Paycos. You can contact the CERT contractor to send any subsequent ADR letters for that particular review to an alternate address. If a claim is selected, then in June, you have to start the process all over. The first ADR is going to be sent to the address on file with Paycos, and then the subsequent letters can be sent to an alternate address. There's also some information here that pertains to those providers who have at least 10 PTAN or Oscar numbers who would like to elect a single point of contact. They call this the chain address program, and the steps to take to enroll in that program are included here on this particular page. There's also some information here about group calls. This is when multiple calls are due to the same phone number. What the CERT contractor is going to do, the review contract that it is, they're going to group those calls so that a single contact can be made with the provider or providers that are associated with that phone number. And then they're going to discuss all of the outstanding requests versus making multiple telephone calls. The next portion of the CERT C3HUB website is this completion status chart, and this is what I told you that you would be looking at in just a few minutes. The CERT contractor, the statistical contractor, maintains this information, and it's really just to provide a look to the providers and suppliers to let them know the status of the well, the completion status for CERT reviews. So they're showing here on this page not only the report year 2025 completion status, but as the current report period, which is report year 2026, the completion status. So as you can see, report year 2025 is completed, the review. You see the total number of claims reviewed there, 37,653. And the completed claims was 37,581 for that report year. That claim report year, those claims are currently under review, it says here. And when the information is complete or when the reviews are complete, you'll find that information out on the CMS website. And I'm going to show you that real quick. Going to CMS's website, which is cms.gov. And I'm going to, I like to search, I'm a searcher, not a navigator. I'm going to just search for CERT report and enter, or click on CERT, and you'll see the first hit, if I will, or if you will, comes up as CERT reports. This is where you will find for each report year, the report name and the release date. So as I was just mentioning to you, the 2025 report year is still currently under review, so that is why you're not yet seeing it over here in the CMS CERT reports. If you've never had an opportunity to look at these CERT reports, there's all kinds of really great material in there and drill downs that pertain to the CERT review findings. I recommend that you take a look at it. Next up is the claim status search. This is where on the CERT C3HUB you can enter a 7-digit claim identifier, which is the claim identification number. Here, it's a 7-digit number you can enter here to see the status of your CERT claim. Now, WPS also offers something very similar, and it actually provides a little bit more detail than the search on the CERT C3HUB. So I would like to pull that open. You can just hang in there with me while I'm getting it ready on my screen here, my other monitor, and I'll pull it over, show it to you. Here is the WPS website homepage. If I can pull it open here. I am the searcher. CERT Lookup tool is what I'm going to key in there. And you can see, after accepting your licensure agreements, Here are results. The first one is a CERT claim lookup tool. And this is where you can enter that same 7-digit number, click on search, and see the results of your comprehensive error rate testing claim review. You do need to enter that CID number, and that CID number comes to you when you receive that request for documentation. There is a barcode on the request for documentation letter that you receive from the CERT contractor, and you will need to actually place that on top of the records when you return them. But you'll need to keep a copy of everything you return. Just a good best practice to keep a copy of everything that you're returning to the CERT contractor. But look at that CID number on there, on that barcode sheet. Enter it here, click search, and it's going to tell you if there was no error, or if there was an error, you're going to be able to actually see the CERT comments for all of the lines in error on the reviewed claim. It will also tell you if the review is not yet complete, that it's under review, it's not yet complete, further information not available at this time. So all kinds of great information. You can follow up to view to determine if there was an error found. Because if there was no error on your CERT claim for their review, there is no notification sent to you. So this would be the only way that you can see that, yes, your claim was reviewed and no error was assessed. In addition to finding that information on the WPS website under tools up here, it's tools, you'll be able to look at all tools and then look at for CERT claim lookup. That's just another way you can get to this and navigate to it. There's a number of ways that you can do that. So here then is the CERT C3HUB's claim status search. And as I mentioned to you, when you look on WPS's website, you're going to see more information about that claim review than you will out here on this site. You can look at both if you like. Here is some information that's offered in this menu. It's the CERT Disaster Damage Administrative Relief. In the event of a disaster, the CERT program is going to, of course, grant temporary administrative relief to any of those providers and suppliers that were affected. You can see here on this webpage how CERT defines a disaster. Could be a natural disaster, could be a man-made disaster, you know, hurricanes, tornadoes, earthquakes, so on and so forth, even fires. This provides you with a link to the CMS Emergency Response and Recovery website, and it also provides additional information there for you. Talks about that administrative relief that's applied to entities when their physical location or mailing address is impacted by that disaster. So in those cases, the administrative relief guidelines will follow for a period of 90 days from the effective date of that declaration of the disaster. So here it talks about the fact that the CERT review contractor is not going to send any ADRs or attempt any telephone calls to request documentation or finalize any review decisions on claims for those providers and suppliers affected by the disaster. And again, that's for a period of 90 days following the effective date of that declaration. Next up, you can choose to take a look at some information that's being provided about attestation letters. And sometimes there are situations where a medical record is completely destroyed. It could be due to a disaster. In that case, the provider can submit a disaster attestation letter to that effect. If the records were partially destroyed, they can submit the portion of the medical records that do still exist and submit the disaster attestation letter for the remainder of those medical records, those that were destroyed. Again, CMS or the CERT contractor provides for CMS here on this website the definition of disaster. On behalf of CMS, I should say, they provide it. And then they have links to those disaster attestation letters here for you on this page. You can see that it's not only in English, but in Spanish as well. There are also signature attestation statements. CMS has issued guidelines that clarify their Medicare fee-for-service signature requirements. And these are signature guidelines for medical review purposes. They are in the form of Medicare Learning Network articles or MLN articles. Those are those national or CMS published outreach publications that apply to all providers across the U.S., all providers and suppliers. There's also a link to the transmittal here. In this case, the change request that speaks to signature guidelines for medical review purposes, and some contractor learning resources as well. So some great resources for you regarding CMS signature guidelines for medical review purposes. And then down here near the bottom of the page is the signature attestation statement in English and in Spanish. This is the form that providers can use to provide a signature attestation for those medical records when the signature has been or is missing. This just simply attests to the fact that the provider did write the record or the information in the record, and they're attesting to the fact. Now remember that attestation statements will apply for things such as an unsigned progress note, but an attestation statement cannot be used when you do not sign your lab orders, for example. So there are times when the statement is acceptable, time when it's not acceptable. And you can find more information about that on CMS's website. Sample request letters is next, and this is probably the part where most providers are going to most often come back to when they receive that ADR from a CERT or from the CERT review contractor. You can see that all letters are available in both English and in Spanish. There is the Part A initial letter, that's that initial letter for documentation. Part B initial letter, there's a Part A inpatient hospital initial letter, and also a DME initial letter, and DME is durable medical equipment. There's also a chiropractic services initial letter. And then there is the ADR, or the additional documentation request to a third party provider letter, and there's an ADR to the billing provider letter. So all of these letters, the initial letters, are delivered in an envelope that looks like the one showing here on this particular feature of the CERT C3HUB website. You can find that under sample request letters. If you're curious as to what the letters look like, I'm going to go ahead and click on this one and open it so that you can see it. Of course, it's going to have the provider name. Let me make this a little bigger for you. Provider name and address. And remember that for this initial letter, it's being pulled from PAYCOS, okay? The provider enrollment chain and ownership system. So another good reason to make certain that your enrollment records are up to date. The date, the reference, here's that CID number that I talked about earlier. It's that 7-digit number. It goes right here. Provider number, phone number, fax, and it tells you that this is the first letter and it is the additional documentation. It is being sent to you for that additional documentation request. The subject, of course, would be that the additional documentation is required for this CERT review. It tells you the reason for selection. It tells you specifically the medical records that are required as you scroll down this page. When you need to respond by. And that reminds me, July is CERT Awareness Month, and the CERT AB MAC task force is taking that time to make certain providers know how important it is to respond timely to these documentation requests. For the 2025 report year, you know, we just looked at the graph a little bit earlier that showed that it was still, the reviews are still pending, if you will. we want to make certain that providers know when they need to submit their records so that they do submit those before the deadline date. Because if during the review process you don't return your records timely and they move to the next report year, anything that was not received by the due date is going to be considered a non-response. So if you have medical records that were missed, or that you have to send for a subsequent documentation request, make sure you're getting those in timely before that new CERT report year starts. Talks here about the consequences, gives you instructions. This should look really familiar right here, these submission methods, because we looked at that on the CERT C3HUB's website. This tells you if you have any questions, who you can contact. And these questions are about the request for the documentation itself. If you have questions about CERT, the CERT claim results, I'll show you where you can find an email for that. I showed you just a little while ago the CERT claim lookup tool. In these articles, let's look at this J5 MAC Part A. You can see that there is an email address provided on the CERT claim lookup tool page if you want to contact us about questions pertaining to your CERT review. But those questions that pertain to this documentation request or these records that are being requested need to go to the CERT contractor, and that information is here in the letter. I mentioned to you earlier, when you return your CERT, your documentation to the CERT contractor, you're going to include a barcoded cover sheet. So the attachments to this letter include the claim information and the barcoded cover sheet that you need to return along with your records. That's their way of matching up those records that you're sending in to the ADR. So this is the coded sheet that you'll place on top of your records. And it's actually a QR code that they're using now. Okay. Back to the CERT C3HUB. One of the important things when you receive a request for medical record documentation is that you verify the request is legitimate. That's why the CERT contractor wants you to see here what that envelope looks like that you'll receive your request in. All right, this is a list of document requests based on the claim type. CERT reviews all fee-for-service claims, and that includes durable medical equipment or DME, Part A claims, and Part B claims. So what they've done here in this feature on their website that's particularly helpful, when you receive a request for documentation, you can come out here to a printable list that provides the required documents that you need to send back to the CERT contractor. They talk about what you need to send in their request letter, but they don't actually list everything. So that's why I want to show you this. This is a page that providers find particularly helpful. I like to point this out when I'm talking about CERT review. So it lists for DME. It provides document request listings in Part A. I'm going to open Part B and we'll take a look at that. So you can see ambulance, those providers, specialty 59 providers. If you receive a documentation request letter, this up, it tells you what it is you need to return, both in English and in Spanish, when sending your documentation to the CERT review contractor. Now, these are specific to the CERT contractor, but it might not be a bad idea to take a look at these for claims that or for those situations when a MAC contacts you, or WPS, if you're Iowa, Kansas, Missouri, Nebraska, Michigan, or Indiana, you can take a look out here because it would be that same claim that would be subject to CERT review. So you're going to want to make sure that all of this information is available should a CERT review contractor or any other medical review contractor request records from you. So there is ambulance. Here's chiropractor, specialty 35. You might be asking yourself, what does specialty mean? She keeps talking about a specialty. A specialty code is a 2-digit code that is assigned when a provider enrolls in Medicare. For most providers, you self-designate your primary specialty. You might have a secondary specialty or a tertiary specialty, but it is only that primary specialty that is used during initial claim processing. So again, specialty 35 is chiropractor. We looked at specialty 59, which was ambulance. Let's take a look at more. There's emergency room physician services, pain management, psychiatric services, including those by a clinical psychologist, and it shows other provider specialties. 26 is a psychiatrist. 68 is a clinical psychologist. 80 is a clinical social worker, just to name a few. You can also see there's listings for therapy services and therapeutic radiation services and others as well if you come back through here. Now, a lot of these pertain to a particular specialty. For those where a specific specialty is not listed, you would come here to this top item, all other professional services billed to Medicare Part B. Let's take a look. Clinic or office notes, consultation reports, diagnostic test results, including imaging reports, history and physical, operative report, any ABN issued to the beneficiary for each date of service, and for each service or specific service an ABN was issued, and so on and so forth. So I didn't read through all of them. I'll let you come back to this website and take a look at it, but some really helpful information in these document descriptions, what it is you need to send to the CERT contractor when your claim is selected for review. Next up, speaking of some of those psychiatric and mental health specialties that I just talked about, just for those providers, specifically those that are eligible to bill for psychotherapy services, the CERT contractor has placed specific information out here that is really CMS's special instructions for providing documentation for psychotherapy claims. Patient authorization is not required for the release of information excluded from the definition of psychotherapy notes, and the provider should release the non-psychotherapy note material to demonstrate that medical necessity. So here, if you choose to click on the link on this page, and it's taking just a little bit of time here to open, we'll see how long. Here's some information that speaks to, published to help those psychotherapists and providers who bill for psychotherapy services. So information here about what you do and do not have to submit in your documentation that's being submitted to a Medicare medical review contractor, which of course would include the CERT contractor. Here is a holiday calendar to tell you when the CERT review contractor is available. In this case, we just had a holiday this past week, but you can see the next holiday closure for the CERT contractor will be Friday, July 3rd. That is Independence Day. The CERT contractor also on their website has a number of frequently asked questions that you can come to if you're looking for information about the CERT program. What is the CERT program? Will you include a release with your medical record? It talks about if you release the information, will you be in violation of HIPAA regulations? And the answer to that is providing medical records of Medicare beneficiaries to the CERT program does not violate the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. Again, some information about where you need to send records. One thing I should mention to you is that the provider that billed the claim is the one that's responsible. This is question 8. Is the one that's responsible for maintaining all documentation to support the services on the claim. This may mean if your claim is selected for review, that you might need to go to another party in order to get your hands on documentation to include with yours when submitting your records to Medicare in order to help support medical necessity. This has happened a couple of times to providers that have contacted me saying, we don't have this here at our office. The test was done over at the hospital. Um, if you are billing for a service, it is your obligation to maintain all of the documentation that's necessary to support that service, and that includes proving medical necessity. So you will need to get your hands on that documentation and send it along with your personal documentation in order to let Medicare know that the service was indeed medically necessary. Some other frequently asked questions here as well. Talks about a contractor ID, what is an ABN, a lot of information, just general questions that are related to the CERT review contractor's request for documentation. Here's information, documentation from referring or ordering providers. Again, sometimes the referring or the ordering provider may have records that you might need to get your hands on to submit, depending on whose claim is selected for review. Back over to the menu items. Here we have CMS links, links to the CERT homepage. There is a PowerPoint about CERT. Again, I just hosted just a little bit ago a webinar about, it was an overview of the CERT process. So you can take a look at that if you'd like to do so. It would be on our YouTube channel and also on the WPS live events webpage, a link, or no, the Encore presentations webpage. Sorry, I was keying and I kind of stopped my train of thought there, but let me show you where you can find those previously recorded events out on the WPS website. You would come up here at the top of the page. This is our home page on the WPS website. It's Training Center. Training Center is the Outreach and Education Center that we kind of own this page, those of us that work in outreach and education. Here is the live events where you can find webinars like this one today, but once they're recorded, if they're available, sometimes there's technical issues that, we're not able to post a recording, but for recent recordings, remember 60 to 90 days, you can come out here and actually open the YouTube video right from this page. There's a player installed on our website so that you can do that. You don't actually have to go to our YouTube channel. However, after 60 to 90 days, these older recordings are going to be dropping off, and then you'll need to go to the YouTube channel in order to view it. So you can easily open these up. One of the things that we recently did to our recordings of webinars, and which would include, of course, anything that we've done on CERT, is we've added channels. So when you go to the YouTube record page, in the description, you'll find chapters, rather, not channels. They are chapters that are listed, which if you're looking for something specific within the recording, you don't have to listen to the whole thing. You can kind of pop around, but the chapters help you just kind of find what you're looking for more easily, so that you can go to the questions and answers at the end of the event, if that's what you're looking for. You can go to the introduction if you want to, so on and so forth. It's just a quick way to navigate and help people find what they're looking for. So more links here. I mentioned to you earlier those CMS guidelines that are special for psychotherapy claims or documentation of psychotherapy claims. What do you have to release to Medicare, or what do you not have to include when you're sending your documentation? Here's that link to the CMS information on that. So I just thought I'd point that out for you. Some easy links here for you. here is the last topic that I'm going to walk through today, and that is just how you can contact the CERT Documentation Center. It provides you an email address as well as toll-free telephone number. The fax number is listed there too. So ways to get a hold of that CERT contractor. And remember, if you're requesting information about a particular claim or results of a review, you can send that information or that question over to WPS. Again, when you're looking at the CERT claim lookup tool, you're going to find that email address on that page right here within that resource. Really quickly, I just did a quick simple search in our website, and I know this webinar is not designed to talk about our website today, but I do want to point out to you something because it really relates back to everything I've shown you today that the CERT contractor does, and that is right here. I just did a simple search on our website, on WPS's website. I put the acronym CERT here and hit enter, just so you can see the results that show up. Here's that claim lookup. This is what I want to point out, the quarterly CERT error findings report. This is a compilation of all of the CERT errors that were assessed during the quarters of the calendar year. What we have done is we have reported these based on the type of the error that was assessed. I talked earlier about claim or error categories. One error category is insufficient documentation. 74% of our Jurisdiction 8 Part B quarterly CERT errors for January 1 of 2025 through March 31 of 2025 were due to insufficient documentation. All right, and then it gives you reasons for errors. I mentioned to you earlier, when you use the CERT, the claim status search on the C3HUB, or you're looking at the WPS CERT claim lookup, I talked about those comments that the CERT contractor makes that we about the CERT review findings, and we include those when you're doing that status search on our website. This is what we're talking about right here. Those are the CERT review contractors' comments. This is the information they send over to us of why that CERT error was assessed for that claim line or that claim. One of the things that I like about this is not only do they tell you the reason, but they provide you with the citation. Where do this? Where are the CMS guidelines? And they're all listed right here. So some great information. You know, sometimes providers take a look at their CERT records to determine compliance. They'll do a self audit. They'll pull so many charts for a particular item or service, and they will look to see, is that happening within their entity. You know, they'll look at the documentation. Incorrect coding, 24% during that quarter, so on and so forth. And here's a lot of great resources. We do update these quarterly. So some good information. And if I could suggest a tip to you, you can send WPS an email and ask for a list of the CERT errors that have been assessed for you. That would go probably to, let's see, customer service or freedom of information rather. When you were asking, you know, which of my claims that were selected for CERT review were found to be in error, wouldn't you also want to know which of the claims that were selected by the CERT review contractor were not found in error? Because you want to see, these are examples of claims we submitted correctly, or we coded correctly, or documented correctly, and these are those that the CERT contractor found errors. So consider that if you are one of those providers that does occasionally ask for your CERT review results. Don't just ask for those that were found in error. Ask for what you did right. Those are great examples to learn from also, okay? So just something to keep in mind. All right, I am showing we have about 10 minutes left. So I am going to open this back up to Bailey to see if there have been any questions received. Bailey, go ahead.
There have not been any questions in the chat.
Okay, great. And I did look at the registration document that we can download. We look at that before each event because within it we ask providers, what was that one question that you would like answered during the webinar? And of course it would need to pertain to that topic that, so that we could talk about it during the webinar or include it in our prepared remarks. But for those questions that don't pertain to today's topic, we can just simply answer in another way, but we don't answer them during this webinar. So we really didn't have any questions in that registration document, just people looking for general information or a look at, a walkthrough of that CERT provider website, the C3HUB. All right. I do want to take just a moment to mention to you that in a couple of minutes, and if you've ever come to any of our presentations, you've been asked to complete a brief survey. I want to tell you just how important your comments are. We are very committed to making changes, and we do that to improve your education experience. We have made changes based on what we have heard from you in that survey. One is those chapters that I talked about that we added to YouTube videos. Another recent change is the addition of training indicators in our webinar announcements. Training indicators are an alpha or an alphanumeric 2-digit code that tells you specifically the audience that that particular training is designed for. Is it for billers? Is it for coders? Is it part A? Is it part B? And so on and so forth. So we have been asked for that, and we have made that change based on your survey comments. So thank you for that. Keep those coming. Now, I want to talk about CEUs because many of you are joining us today because you want continuing education units. In a few minutes, you will receive an automated email. It's going to come from WebEx, not from WPS. It will thank you for attending. If you look at this slide right now under Certificate of Achievement, you'll see some verbiage there. And this isn't specific to our webinar today, but this is just an example for another webinar that we held back in 2025, earlier in 2025. This is the verbiage in that email that you need to look at if you are seeking continuing education units. It's there. You might not see it when you get your email. You're going to see, thank you for joining us, blah, 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 blah. Look for this information. This is the information you need to submit to an accrediting body or an organization that you are going to request continuing education units from. So make sure you're looking for that email. Now, if any of you joined us by phone only today, you will not receive that that automated email from WebEx because they don't know your telephone number. If you need CEUs and you don't receive the automated email, for example, if you joined by phone, send us an email. It's that same WPS email. It's shown here on the bottom left side of this slide, and Bailey can place it also in the chat. And tell us you attended today's event, the name of the event, today's date, and give us your telephone number. After we verify your telephone number on our records, we'll send you a certificate of achievement. Now, remember that that automated email is just going to include the verbiage like you see it here on the screen. There's not an actual certificate. There's not an attachment. It's in the body of the email. If you send us and request that certificate of achievement because you didn't get the automated email, then you will have the attachment. Okay, we get a lot of questions about that. All right. Now, we didn't have any questions from any of you during today's presentation or during the live event, none in the chat. But if you think of any presentation related questions, or you do have 1 week from today to submit them, send them to our education mailbox and place today's topic in the subject line. Then the person opening that email or that mail in that mailbox will know to send it over to me, and I will get that answer out. And again, please don't send any claim specific questions to to me, these questions need to be about what I talked about today. Claim-specific questions have to be handled in customer service because I don't have access to any claim history information. I do show a couple of more minutes. Bailey, do we have any questions?
I have not seen any come through.
Well, that is just terrific because that gives me a lot of time to tell all of you that your comments, your input, you make our day when you complete this brief survey. It doesn't take long. This is how we know to improve the customer experience for all of you. We want to know about your wants and needs. What's on your wish list? What do you want to hear about in future webinars? Do you have an idea of something we could change up? So on and so forth. So please take a couple of minutes to complete this survey to let us know how we did today and what we could do to improve in the future. There's different options depending on your preference. We think this survey is so important that we give you one last chance, and not one last chance. You can actually use the link that is in your presentation materials to do that. You don't have to do it right this minute or today, but sooner is better than later. When you leave today's webinar, you will have a pop-up come up. It's going to look like what you see on the bottom part of this screen. It says external site. There is a triangle at the top. You're actually going to go from WebEx over to this destination site, and you can see it highlighted there. It's a CMS survey site, and this is where you can complete that survey that is so important to us. If you've not already completed it, that is. Some of you might be doing it right now, but please, we look forward to your feedback. We look at each and every one. CMS pays attention to these as well. We have staff that looks at every single one of these, and we make a list of those suggestions you make, and then we talk about them later. And a lot of them we take action on. So thank you for those of you that do take the time to do this. For those of you that don't, please do. All right. At this time, on behalf of myself and Bailey, Ashley, and our entire provider outreach and education team, I just want to thank you for your participation. We know how busy all of you are, and it's often hard to take time away to attend our sessions. So thank you for doing so. We do look forward to your survey comments, and we hope to have you join us for future events. You may now disconnect.